Common skin conditions. The skin is one of the most important body systems for a home health aide. Much of what you do affects and is affected by the skin and its health. Some of the most common conditions you'll see is dermatitis, psoriasis, Raynaud's disease, fungal infections, skin abscesses, cellulitis, shingles, and parasites. Dermatitis is the term used to describe skin irritation. It has different causes, but they all involve itchy, dry skin or a rash. The three most common types of dermatitis are eczema or atopic dermatitis, dandruff or seborrheic dermatitis, and contact dermatitis. Eczema is a very common condition that makes the skin red, dry, and itchy. It may also have red to brownish gray patches on the hands, feet, ankles, wrists, neck, upper chest, eyelids, and on the inside of the elbows and knees. It can be chronic, meaning it can last a long time, but may only flare up now and then. Generally, if your client has eczema, you should avoid using harsh soaps, apply lots of moisturizer, and apply any medicated cream that's been prescribed by the doctor. If your client is having an eczema flare-up, make sure that they take shorter or fewer baths or showers and use warm water rather than hot. If they have any food triggers, it's best to carefully avoid these foods during a flare-up. Dandruff or seborrheic dermatitis is a common condition that usually affects the hair, but can also affect other oily areas on the body, such as the face, nose, eyebrows, ears, eyelids, and chest. Signs and symptoms can include skin flakes on the scalp, hair, eyebrows, beard, or mustache, patches of greasy skin covered with flaky white or yellow scales, or crust on the scalp, face, chest, armpits, groin, or under the breasts. It can also include red, itchy skin. Generally, treatment for dandruff involves medicated soaps or shampoos. These soaps should usually be used daily until symptoms are gone. Many times these shampoos may be left on for a certain amount of time before being rinsed off, so carefully check labels for directions. Avoid using styling products like hairspray or gels while treating the condition, and avoid skin and hair products that contain alcohol. If your client has a beard or a mustache, be sure to treat that area as well. Contact dermatitis is a red, itchy rash that happens when the skin comes into contact with something the person is allergic to. Common substances that can cause reactions are soaps, cosmetics, fragrances, jewelry, plants such as poison ivy or oak, and adhesives. Treatment usually involves avoiding the substance that causes the reaction. If it is impossible to completely avoid, such as with reactions to metal, some strategies are wear protective clothing or gloves. Apply iron-on patches to cover metal fasteners in clothing. Apply a barrier cream or gel. Moisturize regularly. Be careful around pets. Often allergies from plants such as poison ivy can cling to the pet's fur and can spread to people. Psoriasis is a chronic skin disease that causes red, itchy, scaly patches, most commonly on the knees, elbows, trunk, and scalp. It is thought that psoriasis is caused by a problem in the immune system, where skin regenerates faster than normal rates in certain spots, causing the scaly red patches. Psoriasis can look very dramatic, but it's not contagious, and it's thought to be caused by both genetic and environmental factors. For most people, psoriasis goes through cycles, flaring up for a few weeks or months, then going away for a period of time. This is what psoriasis can look like. Many people who have psoriasis can be symptom-free until suddenly triggered by an environmental factor, such as an infection in the skin or throat, cold, dry weather, an injury to the skin such as a scrape, bug bite, or severe sunburn, stress, smoking, heavy alcohol consumption, certain medications such as lithium, high blood pressure medications, and anti-malarial medications, suddenly stopping oral or systemic corticosteroid medications. Psoriasis treatment usually involves applying medicated creams and ointments, light therapy or exposing the skin to controlled amounts of sunlight or artificial light, oral or injected medication. It's very important to understand how to apply the treatments and how often. If you're unsure, check with your supervisor before starting. Some medications and medicated creams used for psoriasis can be dangerous to you if you're pregnant or trying to become pregnant. Always wear gloves and speak to your supervisor for reassignment if you are concerned. There are many types of skin rashes that are caused by fungi. The most common are athlete's foot or tinea pedis, nail fungus or onychomycosis, ringworm or tinea corporis, or a yeast infection called cutaneous candidiasis. You can prevent fungal infections. Fungus grows on skin that remains warm and damp. Change your client's socks and wash your client's feet regularly. When cutting toenails, cut straight across the nail. Never mix nail clippers from infected nails to healthy nails. And if your patient is incontinent, make sure to change their briefs frequently and use products to protect the skin and keep it dry. Fungal infections are usually treated with antifungal powders, creams, or soaps. These treatments may come with specific instructions, so be sure to read the directions carefully. If your client is diabetic, they will be at increased risk for fungal infections, so help them to control their blood sugars. Skin abscesses resembles a pimple, but it's deeper and larger. Where there is an infection in the skin, the body tries to protect itself by creating a wall around it, thus creating the abscess. The abscess is a pocket filled with bacteria, white blood cells, and dead skin. The most common bacteria found in skin abscesses is Staphylococcus aureus, also known as a staph infection. This bacteria is found on most people's skin without causing any problem. But if there's a break in the skin, such as a cut, in a hair follicle, or at the edges of a wound, an abscess may form. This can be what an abscess may look like. Treatment usually involves a procedure where the doctor makes an incision and drains the pus out of the pocket. The client will likely have a dressing afterwards that must be kept clean and dry. Sometimes the client will have to take oral or IV antibiotics. It is very important that the client finishes the entire course of antibiotics, even if they are feeling better, to prevent antibiotic resistance. Abscesses left untreated can have serious complications and could become life-threatening. If your client develops a fever, becomes weak and drowsy, or if their pulse rises and blood pressure drops, they should seek medical attention right away. Cellulitis is another infection of the skin, but instead of forming a pocket, it spreads throughout the layers of the skin. If left untreated, the infection can quickly spread throughout the body and become life-threatening. Symptoms of cellulitis are hot, red skin that expands quickly, pain and swelling, and fever. Treating cellulitis usually involves oral or IV antibiotics. Depending on how advanced it is, your client may have to receive treatment in the hospital. They may have a dressing in place that must be kept clean and dry. And make sure your client finishes the entire course of antibiotics to prevent antibiotic resistance. There are different ways that you can prevent skin infections. Some clients with diabetes or those that have poor circulation will be at higher risk for developing a skin infection. Good skincare can prevent infections before they start. If your client gets a cut or scrape, keep it clean and cover it with a dressing right away. Inspect their feet daily and watch for wounds or signs of infection. Moisturize their skin regularly to prevent cracking and peeling. Trim finger and toenails carefully. Protect their hands and feet with proper footwear and gloves.